Today, we're going to explore more about non-invasive blood pressure measurement. We are going to understand its principles, methods, and classifications of blood pressure monitoring in clinical practice. Blood pressure is a vital clinical parameter that reflects how hard the heart is working to pump blood. Traditionally, it's measured using a sphygmomanometer, which once used mercury but now uses electronic or aneroid systems. Each heartbeat produces systolic and diastolic pressures, and these values help determine a patient's cardiovascular status. Blood pressure isn't static, it fluctuates during the day due to stress, exercise, or posture. Clinicians interpret readings relative to what's normal for each patient, considering age and condition. A reading of 160 millimeters of mercury in an elderly person may be normal, while the same in a young adult could indicate hypertension. There are two main ways to measure arterial pressure: invasive and non-invasive. Invasive methods involve inserting a catheter directly into an artery, offering continuous readings but with higher risk. Non-invasive methods use cuffs and sensors, ideal for routine monitoring due to ease and comfort. Palpation is a quick way to estimate if circulation is adequate. Clinicians feel for pulses in different arteries, carotid, femoral, or radial. It's a rough estimate and shouldn't replace proper measurement, but it helps in critical situations where equipment isn't available. In the auscultatory technique, clinicians listen for blood flow sounds as the cuff pressure is released. These sounds, called carotid cuff sounds, indicate the transition between occlusion and free flow. Mercury manometers were once the reference standard, but due to safety regulations, they're largely replaced by aneroid and electronic models. Oscillometric monitors use a pressure sensor to detect pulsations in the cuff as blood starts to flow again. A built-in algorithm estimates systolic and diastolic pressures. These devices are easy to use and ideal for home monitoring, but they must be calibrated and sized correctly to maintain accuracy. Blood pressure readings can be easily skewed by technique. The cuff must be on bare skin and at heart level. Lifestyle factors like caffeine intake or stress can cause temporary elevations. Consistency in timing and posture ensures reliable results, especially for long-term monitoring. Blood pressure monitoring provides critical insight into circulatory health. Persistent hypertension increases risk of heart failure, stroke, and kidney disease. Conversely, hypotension may signal shock or blood loss. That's why accurate BP measurement is foundational in nearly every medical assessment. To sum up, understanding how blood pressure is measured and what affects its accuracy is essential for clinical practice. Modern electronic devices have made monitoring easier, but the fundamentals of good technique remain the same. Always consider patient context and follow proper procedure for dependable results.